Hello, I'm Dr. James Bogash. I'm the author of the articles here on modernhealthmyths.com. And today we're going to continue the discussion on single payer system and here in the United States and why I think it's a very bad idea. First part of this video, I explained that there are a lot of things we spend money on that are wasteful or even harmful, and yet we continue to spend money on them. The other big factor, and keep in mind my opinion may be a wee bit biased on this because I am a chiropractor, but the data that has been shown for chiropractor when they're involved in the healthcare system is a massive cost savings across the board, both on medication uses, pain management, on surgery, and hospitalizations. Then when you start to factor in the downstream savings from people not having side effects of drugs or actually fixing problems, then there's a massive cost savings associated with that. And we've seen several studies that have continued to support this, both within the workman's comp arena, with far less drug imaging and surgery use, as well as outside of it. There's been several studies published on cost savings where chiropractors are the first point of entry. The other thing to consider is that one of the largest cost drivers for most of the healthcare systems is non-surgical spinal complaints. While that seems strange that we would think that it would be cardiology or oncology, it's not the case. Non-surgical spinal complaints is one of the largest cost drivers in any healthcare system. One of the largest healthcare systems in the United States, the world, but in the United States, they did a study looking at what would happen if a chiropractor was the first point of entry and whether there'd be cost savings. They were the first entity to look at not just what happens in that office, but what happens over the course of the episode of that non-surgical spinal complaint. When you look at just the cost payments of a chiropractor versus a primary care doctor, those were the closest. Pain management, PT, those are through the roof, as you would expect. But with chiropractic primary care, they were close. Primary care was actually a little bit cheaper. Wasn't until you looked at the entire episode of care that you found that chiropractic was associated with a significant cost savings. And that didn't even involve surgery. If you added in the surgery, we'd find that chiropractic as a first point of entry would be massively lower because surgery obviously adds to a great percentage of the costs. But the thing is that most cases are handled within a chiropractic office. We don't see additional costs for pharmacy, for imaging, for pain management, or the surgery was not looked at, but those would all be encompassed. So when you look at when a chiropractor is involved in a case of non-surgical spinal complaints, our costs are significantly less, to the point where this employer, this insurance company found that the savings over the course of 3 years would be in billions of dollars for non-surgical spinal complaints. And that didn't even account for the downstream savings from less side effects and potential resolution of the problem. The other real issue with this is, despite the fact that chiropractic care has been shown to be a significant cost savings, no matter where you input chiropractic into the system. If we look at a single payer system here in the United States, the closest one we right now have is Medicare. And Medicare covers very little of what chiropractors do in the office. Don't pay for exams, don't pay for any therapies. Pretty much nothing that we do in the office is covered under Medicare except one small portion. And my fear is that if we went to a single payer system, what we would see is very little chiropractic coverage and lots of coverage of these other things that are wasteful and potentially even harmful. Again, that's my biased opinion, but it's backed up by research. And if you want to find that, I covered on a lot of that in my Obamacare blog post, which I'll put in the links, that you can kind of read through and look at the references, just the supportive information for this. So even though my opinion was biased, it is influenced by some of these studies. And I know personally, our office, I'm sure it's similar across the country, that if we had to survive on a Medicare type model, we would not be able to survive as we do now. And that's my fear, is that if we move to a single payer system, one of the provider groups that has been shown to be the most cost effective would be given the least ability to influence the system.